Hi, I'm Vanessa Karubian Saxe, and I'm one of the facilitators for the Toddler program here at Turning Point School. Today we have Dr. Julia White from Robertson Pediatrics here to talk about what to do in case of an emergency at home with your toddler. Every toddler has taken a fall and bumped their head, but when do you know that it's worth checking out?
Typically, whenever someone calls, I'll ask, a few questions. Where is the bump, first of all? If it's on the forehead, those tend to be a little bit better. Also, how large is the bump? The greater that the area of the bump is, the more likely to have more of a serious injury, okay? Was there a loss of consciousness? Or shortly after it happened, has there been a lot of vomiting and nausea associated with it? If any of those situations are present, I usually do recommend going to the emergency room because it possibly could be a more serious head injury. Now, if the child falls, has a little small goose egg, cries right away, stands up, otherwise recovers quickly and is acting completely normal, what I'll typically recommend initially is putting some ice to the area because that's going to help with any swelling. And then what you want to do is really observe the child closely for the first 4 to 6 hours after a fall, because that's kind of the most critical time of when a serious head injury can kind of present itself. So what you're looking for is significant lethargy, not just like being tired, but like being very tired to where it's difficult to keep them up and awake. You also want to look for confusion, which with small children can be very difficult sometimes, but kind of looking very dazed, confused, not acting normal, that can be a subtle sign that something could be going on. And then of course the vomiting, nausea, that could be a sign of a serious head injury. Now, a lot of questions that I get, or especially if it happens right before bedtime, then
that's what I was just going to ask.
Then what do you do? This is a difficult one because putting a child to sleep right after that happens is not ideal because then you really can't watch and observe for those subtle signs, which would be like the lethargy and confusion. So I usually say do the best you can to try to keep the child up as long as you can. So maybe do some activities, maybe watch up on, videos, and we don't
something to keep them awake.
Something to keep them awake for a little while. And then once they do go to sleep, I'll recommend checking on them every, half hour or so to make sure that everything is okay.
So speaking of rough and tumble, what about if they fall off of a play structure and you think they may have broken something?
If it does look like a broken bone, then unfortunately this is one of those situations where you will need to go and have emergency care because depending on what kind of an injury it is will depend on whether it can just be splinted and then followed up with an orthopedic the next day, or in some cases of certain kinds of elbow fractures and whatnot, sometimes if it's displaced they will actually have to operate and set it. So in those situations it is, unfortunately, that's one of those ER trips.
And so what are the clues that something's broken, besides probably a lot of pain and crying?
Right, a lot of pain, any obvious deformations, inability to bear any kind of weight. So usually if it's like a little ankle sprain, they can get up, they're limping, but they're not, but they are able to put a little bit of weight on it, then it's probably okay to kind of watch and see. But if there's cannot bear any weight at all, any significant swelling or deformity, then that should be seen right away.
Hopefully you found that information useful. In our toddler groups at Turning Point School, we not only give our parents access to information like this, but we also provide a comforting environment to talk with other parents and facilitators about how to use this information to parent with as much confidence and joy as possible. We'd love to see you in one of our groups. For more information, please visit Turning Point's website or email toddlerprogram@turningpointschool.org and someone will get back to you right away. Thanks so much.